no matter how well a particular syllabus is configured, we cannot deny the fact that there will be a disparity among the patient inflow in various hospitals. And the policymakers are definitely correct in striving for, in giving a call for uniformity of education. But in reality, it may not be possible. Therefore, when the student comes out of MBBS after internship with the MBBS degree, there may be quite a large number of students who might feel that they have had not a good clinical exposure. They want to go into independent practice, family practice, general practice. They may feel that they have not had a good experience. What does MERC propose for such people? The introduction of a course known as PMRC, Post MBBS Refresher course. And what is Post MBBS Refresher course? It should be a 1-year course that should be offered by every and any hospital without charging any fees for the students. The students should not be charged. That is the Post MBBS graduates, sorry. They are not students anymore, they are the graduates. They should not be charged any money for it. They should be allowed to work in recognized hospitals. Anybody and everybody must be allowed to work in recognized hospitals voluntarily. But these hospitals which agree to conduct a PMRC course, no matter what hospital it may be, there may be very small hospitals, there may be corporate hospitals, there may be mega hospitals, there may be super specialty hospitals, there may be nursing homes, no matter what they are, they must conduct a particular, they must implement a particular syllabus. And what is that syllabus? It is there in front of your screens. 8 to 9:30, 3 topics for thorough discussion, beginning from clinical features and complications to definitive treatment, each of half an hour duration. In every topic, starting from the skull, namely whether it is dandruff of the scalp, whether it is meningitis, whether it is migraine, whether it is dermatological conditions affecting the hair and scalp, from anemia, sinusitis, oral pathologies, thyroid, cardiological, respiratory, chest, general abdominal, renal, diabetes, hypertension, down to the foot infections of common, which are diabetic, common foot infections, diabetic infections, fungal infections. Let us assume that 1,000 disease conditions are shortlisted. 3 topics for thorough discussion every day. 333 days into 3 topics would cover the entire gamut of diseases under the umbrella of general practice and family practice. 9:30 to 1, OPD along with post-MD or MS consultant. Aim to develop the art of history taking, clinical examination and rapid accurate arrival of clinical diagnosis. 2 to 3:30, post-MBBS doctors would examine all the admitted patients, reconfirm their diagnosis, etc., and be prepared for ward rounds. 3:30 to 4:30, consultants would conduct ward rounds and discuss each of the case on the grounds prepared by the trainees as mentioned above. They will actively teach, train and advise them as necessary. Therefore, such an exhaustive, well-structured, well-defined, well-organized refresher course would largely help the post-MBBS graduate to confidently enter the domain of independent private general practice or family medicine practice at a primary level.